Hey everyone, welcome back to the show. I am here joined by my guest, another one of the Neurologic Wellness Institute's very own, Dr. Cassandra Jimenez. Thank you for joining me today.
Hi, thank you for inviting me. I actually was thinking we went to school together, we studied for the diplomate together, and now we're here at NWI making the podcast. So it's great having you as a colleague and my friend. So thank you.
Absolutely. Yeah, full circle. Yeah, me and Dr. Cassandra definitely studied together and got to this point together. So it's pretty cool that we're working in the same clinic now. But so Dr. Cassandra, you want to talk today about primitive reflexes, right?
Yeah, that's right.
Very nice. So before we get into that, I want to know first, why did you pick primitive reflexes as the topic of choice today? And I want to know why you're so interested in primitive reflexes.
Yeah, so my passion is actually work more with concussions and dysautonomia, being a dysautonomia patient myself. That makes I'm more my affinity to those topics, but I also love working with kids. So I started learning about primitive reflexes when I was in school, and I actually took a couple seminars for the neurodevelopmental disorders. So I started to dive in more and more. And now that we see a lot of kids with autism, ADHD in our clinic, and a wide variety of patients, I started to see that over and over that there are a lot of patients with persistent primitive reflexes. So I wanted to change topics a little bit. I know you guys do a lot of concussions and a lot of dysautonomia in the podcast, so I wanted to do something different.
Yeah, and you're absolutely right. So far, this podcast has been very heavily focused on like concussions and that sort of thing. But a big population that we see in our clinics are, like you said, kids with autism, kids with developmental disorders, OCD, that sort of thing. And a lot of those kids do have primitive reflexes still present past the time where they're supposed to be there. So this is a fantastic topic, and I think this perfect topic. So tell us a little bit more about yourself. You said you are also a concussion dysautonomia patient. Is that why you got into the functional neurology world?
So actually, no. I did my bachelor's degree in natural sciences with a concentration in human biology for 4 years. And when I graduated, I was an athlete my whole life, but I have been experiencing tachycardia. I fainted when I was a teenager, and nobody knew what was it. So when I started to look at it, I did glucose test, everything was normal. Nobody could tell me why I was feeling like that. So after I started to see what was dysautonomia, what was POTS, now and all the symptoms, then I knew that I was a patient of dysautonomia. So I know what triggers my dysautonomia right now, and I know what things I can do to help with that. So no coffee, a lot of exercise, a lot of water, and neurological treatment too. So after I finished doing my bachelor's degree, I moved to the doctor of chiropractic, Georgia, to do my doctorate in chiropractic degree. In there, in first and second quarter, I went to neurology club, and I fell in love with functional neurology. I knew that I wanted to help patients with neurological disorders without any medications and surgery. So I started to dive in more into the seminars. I took the neuroscience seminars, vestibular rehab, neurodevelopmental disorders, and some TBI modules while I was in school. I also had the opportunity to publish some abstracts in the journal Frontier, and I'm looking forward to publish more this year. And yeah, I did that for my 4 years. And after I graduated, I sat down for my test for the diplomate 1 month after, and I passed. It was a very difficult test, but it was very nice to see that pass in my email.
Yeah,
And now
you
I have
say it
been
was
in practice.
difficult, but I think
Yeah, I know.
you knew everything, better than just about anyone. So
Yeah. So I have been in practice for 2 years right now, and then with the last one here in NWI,
hmm
and I'm here.
yeah, and now we're here talking about primitive reflexes.
Yep.
So for those parents who, or anyone listening who may not be aware of what a primitive reflex is or what a reflex is in general, can you kind of break down what those are and why they're important?
Yes. So primitive reflexes are involuntary motor responses. They are basically developed in the womb, and they are present after birth. They're mainly controlled by the brainstem, and we know that the brainstem deals a lot with surviving. So they are going to help the newborn survive. So they are for survival mode. Um, Once the nervous system starts to develop, specifically the frontal lobe, we are going to see that these primitive reflexes are going to start to be inhibited. So this happens around 4 to 6 months of age as the brain matures. Um, after that, we usually start to see the postural reflexes, which are the ones that are going to help us walk and balance ourselves against gravity. So basically, this process is a transition between the brainstem reflex response to a more cortically controlled response. And this is the reason why we are bipedals. If we go back to the evolution of the human being, our brain changed because we needed two things. We needed safety, it was the number one, and the second one was conservation of energy. So we started to have inhibition of that flexor tone. We started to basically do more complex activities. So the frontal lobe and the cerebral cortex basically started to develop. And if we compare ourselves right now with chimpanzees or other mammals, we can see that this area of the brain is bigger. So that helps us be bipedals. We have decision making, we can think, and at the same time we can do more coordination and more difficulty activities. So I had one of my mentors, he said like the frontal lobe has two main functions. Like they basically, one of them is bipedalism and the other one is eye contact. And we actually can see it with kids with autism, or we also see it in patients with frontal dementias, that they basically lose that like ability to make eye contact, and at the same time they start to lose this, they started to have postural abnormalities like
Mhm.
slouch posture and other abnormalities like that. So in review, we are born with the primitive reflexes, but once our nervous system starts to develop, they should be inhibited by the frontal lobe.
So you said about 4 to 6 months is typically when a lot of the primitive reflexes kind of uh, go away or shouldn't be
Yeah,
present
that's
any
right.
longer.
There are other ones that are in 1 year, but
Mhm.
yeah, around 4 to 6 months are most of them.
So what would be a reason or a few reasons why somebody over the age of one, maybe a child who's 2, 5, 8 years old, why would they still have a primitive reflex intact?
Yes. So when we see this, it's because the central nervous system is not fully mature. So we see this ones in kids like autism, ADHD, Tourette's, OCD. Sometimes, if we see more than 5 primitive reflexes, it could also mean cerebral palsy or even mental delays. So, and that's one side of the story. We can also see If we don't have the primitive reflexes once they are born, sometimes like that's basically the most important part of the newborn neurological examination. So if we see an abnormal sucking response or reflex, or we see an absent motor reflex, that can tell us that there's a CNS dysfunction, or it could be cerebral palsy. So that's more in infants and in kids, but we also see them in adults. So normally we tell them primitive reflexes, but they are so-called like frontal release signs if they're present in adults. They can be normal in the adult population, but multiple frontal release signs can also be observed in neurological examinations that can correlate with frontal lobe pathologies. So we know that it can be functional, which are the ones that we usually take care of or treat, and it can be more organic. And we know that those frontal release signs, as I said, can be because of the frontal lobe pathologies, including Alzheimer or schizophrenia. We can also see Babinski reflex, which we know that it can be because of an oculomotor neural lesion. We see glabella reflex or palmomental reflex in patients with Parkinson's. So that's an early sign. That doesn't mean that everyone that has glabella reflex is going to have Parkinson's, but with a full examination and the appropriate neuroimaging and neuropsychological consult, we can see if you have a primitive reflexes, if that's basically the case. There's also research that they said that sometimes they see the reoccurrence of grasp reflex, mostly bilaterally, with patients with Lewy body dementia or PSP. So this could be an early sign of those conditions. So, but very important, physical examination, the primitive reflex examination, neuroimaging, and neuroconsult if it's necessary. So not everyone that has reflexes has like these conditions.
Right. So some of the bigger ones you had mentioned were the neurodevelopmental disorders, as well as the neurodegenerative disorders like the Lewy body dementia, PSP, things like that. Mm-hmm. And then concussion as well, I think.
Yes.
What does some of the research say about primitive reflex reemergence with concussed patients?
So we basically in the clinic, we see patients with concussions, anxiety, dementias, but specifically with concussions, I know that like we normally don't test for primitive reflexes for concussions, but it's something that we can take for an objective finding and measure if our treatment plan is helping, or measure if the nervous system is changing too with our treatment plan. There's research that also they basically took these two signs, the frontal release signs and the paratonia, and they tested primitive reflexes in basically 51 participants, and all of them were like had traumatic brain injuries before. So 98% of those 51 participants had at least one primitive reflexes, and 82% had two or more primitive reflexes present. So that's huge. Like for it, I know it's a very small sample, but it's something like that. It can tell us, okay, now I can start measuring, or I can start testing these primitive reflexes. And this actually research is very interesting because they use both of them, the frontal release sign and the paratonia, after a traumatic brain injury, to predict the performance on the bedside cognitive assessment, the level of functional independence, and the duration of the inpatient rehabilitation in this case. So it's something that we can have in our minds and when we are doing a test, and also can help us like pick at the level of the lesion and know where's the level of the lesion for that patient.
Mhm.
And we sometimes we see primitive reflexes with concussions, but that's why it's very important to do a baseline, because me as a practitioner, I don't know if that primitive reflex was before there, because I don't have a primitive baseline for that patient. So that's why we say it's very important for kids that play hockey or kids that play football to have a baseline done. So if they have a concussion in the future, then we know what damage was caused because of that concussion.
Absolutely. What are some examples? So you kind of mentioned the names of some of these primitive reflexes. Can you maybe show us and describe to us some of these primitive reflexes for the people who are listening and the people who are watching?
Yes. So a couple that I like to test a lot. One of them is motor response.
Mhm.
Motor is very important in sound integration, the starter response, the fight or flight, and we see this reflex a lot with patients with anxiety, even with misophonia. We know that misophonia has to do a lot with the auditory pathways that cause like a limbic and autonomic response. So I have seen this reflex with that kind of patients. Motor response is basically you can do it in different ways. You can do it supine, it's basically extending the head, or you can do it standing, where the patient has the hands at 45 degrees, the head back, and you can clap and the patient should fall back, or you can like just clap and sometimes you just see the stutter response.
Yeah,
Other one is going to be,
a lot of times patients would have like sweaty palms afterwards,
yes,
or get really flush, and yeah, so that one is
same
pretty.
system, like fight or flight response, right?
Yeah.
So we know that it could be that. So the flashy
Hmm.
in the cheeks.
Yeah.
Another one that I like to test is the ATNR.
Hmm.
So ATNR has to do a lot about with eye hand coordination. That also has to do with cross laterality. So we see a lot this with patients that have problems with eye tracking. So this one, the way we test it, and there are different ways to test it too. So we tested or in a quadruped position, where you turn the head right or you turn the head left, and you see the elbows like flexing. Or you also can do it standing, where you place your hands like Frankenstein or Superman, and then you turn the head side to side, and sometimes you see that the hands are going with the head when they are not supposed to.
Hmm.
So that's another one that I like to test. One of my favorite is spinal gland. That's one of my favorite reflex. I don't know why, but I like to test it. That one tells me a lot about so we see this one a lot with patients that do bedwetting after 5 years old.
Hmm.
So I have right now a patient that he is depressed, he's anxious, he has problems focusing, and he's 14 years old and he's in Zoloft, he's in Concerta, so he's in a lot of medications, and he has these primitive reflexes very intact. So
Hmm.
I'm working to see if we can inhibit that reflexes. And so far, we have seen really good improvement with that. We're doing other therapies, but that's something that I like to. And actually, I talked to the mom and I asked if he had problems with bedwetting after 5 years, and she actually said like, "Wow, what? How did you know that?" So we tend to see this reflexes in this kind of like the kid or the patient.
Yeah, it's crazy
Um,
how those two can correlate, so exactly
yes.
sometimes. So yeah,
Hmm.
yeah.
Yeah, so this one, the one that I like to test it is basically same thing in the quadruped position, and then you stroke the paraspinals, and sometimes you see the patients flexing the
Hmm.
trunk. So that's the way to test it. And other ones that I like to test are tonic labyrinthine reflex, symmetric neck tonic reflex, rooting, grasp. We can be here the whole day because
Yeah.
there's a tons and tons, but those are the main ones that I like to test.
Yeah, and those might be those last couple might be easy primitive reflexes for parents at home to try. Just like rooting, do a little like
Yeah,
stroke of the cheek and see if you get a little lip twitch from your
like
child.
for
Or
grasp, it's
hmm
something very easy to test.
hmm yeah, yeah. So once you've determined that your patient has one of these reflexes, how do you go about, I guess, resolving that, which would in turn you would expect the brain function then to be improved as well, right?
So every patient is different.
Hmm.
So there's not like a magic pill that I'm gonna give the patients so this reflex disappear. That's like what makes our job very interesting and very fun, but at the
Hmm.
same time sometimes difficult because every patient is so different. So my job is to see what exercises decrease that reflexes. So we also have what we call remediation, primitive reflex exercises,
Hmm.
which we're going to talk about. So specifically for motor response, we do what we call starfish. So that's basically the exercises that we use for that one. If you have spinal gland, we use snow angels for that one. If you have, for example, ATNR, you can do lizard or you can do fencer. And in this case, if you have any Babinski or grass or the rooting, the one that you were talking before,
Hmm.
we usually use or brush or vibration on the side to see if we can inhibit that. And there are other multiple ways to do it. You can use vestibular rehab, for example, Moro and tonic labyrinthine. We know that those two are very related to the vestibular system. So I use a lot of vestibular rehabilitation for that one. So gyrostem, gait stability. If we have, let's say, ATNR, I tend to use more eye-hand coordination. We use the D2, or we can use the NSI. Coordination exercises like cross crawls. I can use sound and light therapy. For that patient that I was mentioning before about the spinal gland, I'm using specifically, I'm doing vibration on the or on the paraspinals, and I'm
Hmm.
actually doing RPSS too in the spine.
Hmm.
And actually, that's what's working for him. And as I said before, it's not like I cannot give you a protocol, but they are things that I have in my checklist. And I do like primitive reflexes, like remediation of the primitive reflexes are the most important one.
Hmm.
So they do this as a home exercises, and I do it too in our therapy, but I incorporate other things to see if we can dampen or remediate those primitive reflexes. And as I
Yeah.
said, like that's basically the basic. If we go to development, we cannot run before we crawl. So we need to go back to the basic. So I
Hmm.
need to remediate those reflex first and then work in the other areas of
Yeah.
dysfunction.
And then a lot of things we do uh, really help the integrity of the frontal lobe too, which, as you talked about earlier, helps to dampen these reflexes. So doing a lot of these like eye movement exercises and other things. You talked about the hand-eye coordination, that sort of thing. That really helps improve the integrity of the frontal lobe. I think are also very good things that tend to help with these sort of things.
Yeah, like anything that has to do with frontal lobe activity is
Mm-hmm.
gonna help with this. Actually, we sometimes we see problems with psychomotor abilities with these patients. So we incorporate catching a ball. So
Hmm.
sometimes that's very simple, but it's very huge for the system. So there's this research that they basically saw the correlation between patients with primitive reflexes and at the same time problems with motor activities like
Hmm.
catching a ball or jumping a road or standing in one leg. So we know that there's a correlation between both of them. And actually, they studied to the when they are the birth date or the week of the birth, it's before the due date, they tend to have more primitive reflexes or they tend to have more problems with motor skills. So that's something that we incorporate too in the treatment. Um, I actually have a colleague that he has right now I think he's 12 or 14 years old, and he cannot catch a ball. So even like this is gonna be home exercises. This is gonna be something that we might do in the treatment because we are gonna think that these kids are gonna have this like everyone's gonna be able to catch a ball, everyone's gonna be able to ride a bike. But the reality is that in the world that we're living right now, it's very like it's difficult for them. Like right now we
Hmm.
are in the pandemic. Kids are 8 hours in the computer taking classes. They are not taking appropriate PE classes. They are not developing these motor skills. So it's very huge. So
Hmm.
after this, we're going to see a lot of kids that are going to regress, or we're going to see a lot of kids that are going to have focus issues or any other problems.
Yeah. So mentioning, I'm glad you brought that up. Mentioning, I guess, the increase in screen time, and then you also mentioned premature babies having a higher incidence of primitive reflexes later into childhood. I guess, what are some of the things that you've seen that, I guess, cause developmental issues down the road? What are some of those factors that tend to show up often in those patients?
Yeah, so these are the patients that has problems with coordination. They
Mm-hmm.
stumble, they cannot run. Sometimes you see like or laterality, or sometimes you see that they run, but they use the same side of their leg, the same side of the hand. Um, Sometimes you see problems with focusing or emotional instability even. Um, and we see all kind of like problems like I said before, like catching a ball or balancing themselves, even socialization. Like right now people are having or kids are having difficult socializing. They are not going outside when they are premature. We see these problems too. Sometimes they have low muscle tone, um, and yeah, the list goes and like on, but I can tell you that screen time and kids that are premature, we can see a lot of problems with that.
Mm-hmm. So, what would you recommend to parents then if they suggest or if they thought that they had a child with developmental issues or primitive reflexes still intact, or maybe even an adult who notices, that they twitch sometimes when people touch their back or get close to their back, things like that. What would you recommend to them?
So basically, I would say to if you notice that your kid has poor concentration, inability to just sit down and not pay attention to you, emotional instability, problems with socialization, low self-esteem, poor eye-hand coordination, I would suggest to you to go to an expert around your area, a healthcare provider that know about developmental disorders and um, know about the primitive reflexes so they can test them and they can give you a appropriate treatment plan for the kid. If we can damp these reflexes early on life, then we're gonna see a huge difference once they are grown up.
Hmm. Great. And obviously, you work with a lot of these patients yourself. So, if somebody wanted to get in touch with you and the clinic you work in, how would they go about doing that?
So they can go to the Instagram or they can go to the website, neurologicwellnessinstitute.com. And there they're gonna have, we have the two locations. We have the one that you work, the Chicago, Illinois, and we have the one that I work in Wooddale. So we have the two locations, and yeah, we're here for you. And we also have the phone number that I don't know right now, but you can go to the website.
Should be in our link somewhere.
Yep.
Should be easy to find. But well, Dr. Cassandra, this was great. I think this was a much needed topic that no one has covered yet. So I'm really glad that you were the one for the job, and I think we did it justice today. So
Thank you so much. Yeah, it's something that we as practitioners are gonna have like in our toolbox, even though practitioners probably that's not your main thing. Like let's say you don't want to specialize in kids or primitive reflexes. I promise you that one time in your life there's gonna be a kid or a person that is gonna need that evaluation, and you're gonna have it in there so you can use it. So thank you so much. This was great, and looking forward to seeing you in the future.
yeah, my pleasure. So this has been your host from the Neuro Wellness Podcast, Dr. Kappas. Be well.